Today in the Daily Dose, CAR T cells fight autoimmune disease. Thanks to the discovery of gene editing technologies such as CRISPR, scientists have made bold advances employing CAR T Cell therapies in the fight against many forms of cancer, while an additional army of researchers have spent years employing CAR T Cell therapies to combat and even reverse the crippling effects of autoimmune diseases, such as type 1 diabetes, lupus, and multiple sclerosis, conditions which occur when immune cells wrongly attack the body's own healthy tissues. For example, in multiple sclerosis, the body attacks the myelin sheath that insulates nerves, while in celiac disease, a delinquent gluten prompts the immune system to attack the lining of the intestine. Short for chimeric antigen receptor, CAR T cell therapies use the patient's own immune system to create both a peripheral and central tolerance to autoimmune diseases through the elimination or deactivation of wayward cells, which in turn become regulatory T cells intent on suppressing unwanted immune responses. To perform CAR T cell therapy, blood is drawn from a patient before T cells are isolated in a lab. The T cells then undergo genetic reprogramming, which allows CAR T cells to recognize specific antigen protein markers on the surface of certain cells. The genetically altered T cells are then multiplied and packaged for reinfusion into the donor patient, which in turn allows the altered T cells to patrol a patient's bloodstream in search of wayward cells such as delinquent B cells. Presented on December 9, 2023, at the American Society of Hematology meeting in San Diego, researchers from Friedrich Alexander University in Germany presented results on 15 patients with a mean disease duration of 8 years, 8 suffering from lupus, 4 suffering from systemic sclerosis, and 3 suffering from idiopathic inflammatory myositis, the later causing muscle inflammation and generalized weakness. In all patients, symptoms improved dramatically up to 12 months after treatment, while all stayed in drug-free remission even after they began producing new B cells, suggesting a profound reset of each patient's immune system. The results are mind-blowing, boggling, outstanding, says Lawrence Steinman of Stanford University, who many consider the father of antigen-specific therapies, making breakthroughs in autoimmune CAR T cell therapies a promising new era in the fight against disease. And there you have it. CAR T cells fight autoimmune disease. Today in the Daily Dose. If you enjoyed this short educational video, consider giving the filmmakers a YouTube super thanks from as little as $1, so that you too can feed the filmmakers who feed your brain.